My name's Alan Slater. I live at Urswick. I had my second hip replacement done on the 25th of April, and I was second one down after going from 7:30 to have it done. The joint school actually told us it would get on and you'd be not to sit with your legs crossed and all these sort of things, and then you'll go in and you'll get out. It'll happen quickly. You know what I'm trying to say. You'll be home within 5 days, definitely, which I was.
Did you have the preload drinks?
Yes. I had all that. And your
So
shower, your power stuff you put on your all over your body and what have you.
Yeah.
But no problem. Your preload drinks helps you to. Well, you don't need your food right away when you after your operation. Then you can have your drink and a bit of toast after it. You're right, like. Yes, I wash my hair and my body and everywhere and.
Yeah. To stop it. Did you understand that?
That's just to stop your infections. But I hadn't got any infection as it happened, but it still won't doing, doesn't it? So as you don't have it.
That's
exactly.
That's
yeah.
Super.
Sorry, anaesthetist come, and she told me what was going to happen, but I knew what was going to happen because the gentleman before, 18 months before, had told me all it. So I was really clued up to what was happening anyway. She did have a little bit of a struggle, but it was nothing, you just go through that, and then you're right, nothing else happens, you don't feel anything.
And did you walk down to theatre?
I walked, I did walk down to theatre, yeah, I did. I went for X-ray beforehand as well. I walked there first and then come back, and then that was in the morning, so at least he put morning on a bit. First time, I didn't have any problem. I was wide awake and bright as a button. This second time, I was all right, no problem. But I don't know what difference it done, but I wouldn't say I was bright as a button, but I was all right. I knew what I was talking about, you know what I mean, straight away. Well, once I got back to ward and there was something on to eat, I got it. No problem, like, yeah.
You felt okay?
Yeah, no problem,
Okay,
yeah.
And did you understand how to prevent your hip dislocating? Was there a wedge between your legs?
No, I still put cushion between my legs when I go to bed, yeah. But I'm lying on my side now. I wasn't lying on my side. I sat up for the first 12 months, 18 months anyway. And after this second operation, I did for another 8 weeks. Yeah. And then
getting used to
I gradually got myself weeded down onto my side. Oh. My pain was all right. It was started to about there, halfway up my chest. And then all below there I had no feeling. And it took ages to come, like I say, not ages, but they kept putting some ice on it.
Yeah.
Aye, and you can gradually feel it coming, Disappearing, yeah. But there's no problem, it soon goes. When you're up out of bed. I was up out of bed that night anyway. Once I got onto my feet again, I was jumping backwards and forwards, no problem to the toilet. Well, first day I managed right full length at passage and back, and then I did it again later on. Next day, second day, right full length upstairs and back, no bother. Third day, Mr. Daz says, "Can I borrow your sticks?" I said, "Yes, aye." My chair was 4 yards away. Walk back to your chair. I said, "All right then, you've done me, haven't you? You've taken mistakes, yeah?" So off I set, and I managed to walk all the way across without touching anything.
Right.
That was third day.
Did you understand what was happening to prevent you getting a blood clot?
Oh yes, they were injecting me in the stomach and that, but no problem. And then they give me the pills.
Yeah. How long do you take the pills then?
It's just a month for pills, yeah, for blood clot job anyway. And painkillers, I didn't take them any longer than a month. I gave over, once I finished with them, that was it. I never took any more. So a month after it, I was on no painkillers whatsoever. I was fully aware of what was happening all the time, yeah, no problem.
And you knew how long you would be in?
Well, yes, he did say 4 or 5 days, but like first time it's 5, second time 4, no bother. Yeah.
Right, so we'll move on to the day you went home. Was there anything particularly worrying you on the day you went home?
No, nothing at all. No.
Did you,
no, because I knew what to do, and I'm completely. But this last hip was done different to the first one. Yeah, the first one was done with stero strips, but the second one he put a collar on and he put about 31 clips in.
Right. Okay.
So I then have about 4 days, 5 days after, 5 days I think it was, maybe 6, I don't know. One of the district nurses come out and she sorted that out, like, yeah. I think did you come and have a look at me before to see my wound was all right?
Yeah.
But it was doing all right. Now the first one, I just got in the shower and that was it.
Yeah.
About a week after, I kept it dry for a good week. You know, didn't get a shower, just washed myself properly and left it so it was dry. Yes, I did feel informed of what was going on, like, yeah.
Right throughout your stay?
Yes, I did have physio to see me on Sunday. I did, because I had it done on Friday, didn't I? Yeah. I had physio come to see me on Sunday and she did, I never saw her again, I'd gone.
Right, okay. You'd gone home. So just the last little bit, Alan. Once you got home, was there anything that happened that you hadn't expected?
Yeah, yes, there is. And you might laugh at me, but with walking with sticks, your brain gets into gear. And how do I get walking? My brain won't let me go without my sticks. Right? So our road's just a little bit slopey down, so I gets going with my sticks, quite a good pace. And I says, here, come up. And I kept going. And I did 60 paces. My first time I kept going without my sticks. I did 60 paces.
Gosh.
Now then, after that I was right. My brain says, you can do it.
Yeah, you conditioned yourself.
Yeah, but only with lifting them up. I couldn't get them, I could not get my feet to go. You wouldn't believe. The pain is unbelievable. Get it done. End of story, yeah. The pain, the first one was really painful. I mean, with having like sciatic nerve problems and everything else. And afterwards, after that was done, no pain whatsoever, completely right. Yeah, and you wouldn't believe how much ease it is after it, yeah.
So no regrets?
No regrets whatsoever.